What is the minimum time after becoming asymptomatic that an individual should refrain from playing sports after a concussion if no loss of consciousness or prolonged post-traumatic amnesia occurred at the time of injury? A. 24 hours. B. 48 hours. C. 1 week. D. 2 weeks. E. 1 month. Answer is C. 1 week. All current recommendations for return to play after a sports-related concussion state that players with concussion should not return to play for at least 1 week after they have become asymptomatic. This is usually increased to at least a symptom-free month for an extended LOC or prolonged post-traumatic amnesia occurring at the time of the concussion. A 15-year-old boy presents after being hit in the head with a baseball. He has a GCS score of 7 and a large hematoma of his scalp, anterior and superior to his right ear. In addition, he is noted to have unequal pupils and a sluggish papillary light reflex of the right eye. Which of the following is most likely in this patient? A. Central transtentorial herniation. B. Cerebellotonsillar herniation. C. Downward transtentorial herniation. D. Uncal herniation. E. Upward transtentorial herniation. Answer is D. Uncal herniation. Uncal herniation is often associated with traumatic extraaxial hematomas in the lateral middle fossa of the temporal lobe. The classic signs and symptoms are caused by compression of the ipsilateral uncus of the temporal lobe on the U-shaped edge of the tentorium cerebelli as the brain is forced through the tentorial hiatus. As compression of the uncus begins, CN3 is compressed, anisocoria, ptosis, impaired extraocular movements, and a sluggish pupillary light reflex develop on the side ipsilateral to the expanding mass lesion. Central pontine myelinolysis is a potential adverse event associated with the administration of which of the following medications? A. Etomidate. B. Hypertonic saline. C. Mannitol. D. Methylprednisolone. E. Pentobarbital. Answer B. Hypertonic saline. Central pontine myelinolysis is a potentially adverse event associated with hypertonic saline administration. Stenson's duct enters the mouth most closely to which tooth? A. First lower molar. B. First upper molar. C. First upper premolar. D. Second lower molar. E. Second upper molar. Answer is E. Second upper molar. The salivary system consists of the parotid, sublingual, and submandibular glands. The parotid is the largest of these glands, lying just anterior to the ear and wrapping around the mandible. The parotid is superficial to the masseter muscle and drains via Stenson's duct, a 5 cm tube that curves around the anterior edge of the masseter to enter the mouth opposite the second upper molar. The sublingual glands lie entirely within the floor of the mouth and drain into the mouth via ductules. They surround the ducts draining the submandibular glands, Wharton's ducts. The body of the submandibular gland is folded around the mylohyoid muscle so that a portion lies within the floor of the mouth and a portion lies external to it. The submandibular, Wharton's, ducts run from the external portion of the gland to empty into the mouth on either side of the frenulum of the tongue. Which term is used to describe bilateral transverse fractures through the maxilla above the roots of the teeth? A. Craniofacial disjunction. B. Le Fort I fracture. C. Le Fort II fracture. D. Le Fort III fracture. E. Trimalar fracture. Answer is B. Le Fort I fracture. Tripod fractures are among the simplest fractures of the midface and include fractures of 3 bones, the lateral orbit, zygoma, and maxilla. More complex fractures of the midface are classified using the Le Fort system, although many complex fractures defy classification with this system. A Le Fort I fracture involves a transverse fracture through the maxilla above the roots of the teeth and may be unilateral or bilateral. Patients may complain of malocclusion, and the maxilla may be mobile when the upper teeth are grasped and rocked. A Le Fort II fracture is typically bilateral and pyramidal in shape. It extends superiorly in the midface to include the fracture of the nasal bridge, maxilla, lacrimal bones, orbital floor, and rim.